Good morning, everyone, on this gorgeous September day, and welcome to our latest webinar, The Impact of the NHS Backlog on Private Healthcare. I'm Brian Goodman, Executive Director of WPA's Major Corporate Division. Today, we're going to be having a look into the increase in private medical claims activity over the last 12 months or so, and what the drivers for this are. Certainly, challenges in the NHS, inflation, and increases in demand are all adding to the mix. Also, with recruitment remaining a challenge, many company schemes are expanding their benefits to attract and retain the best people. All of these are adding to upward cost pressures. For corporate healthcare schemes currently looking at their renewals, this could hardly be a more topical or relevant subject. So I cannot think of two better guests to provide an objective perspective on this. Our first speaker is Peter Connor, Chief Executive of Health Code, which is the industry's clearinghouse for hospital and specialist invoices. Peter is going to share some of the numbers and show some of the claims trends they are seeing. Our second speaker is David Hare. David is Chief Executive of the Independent Healthcare Providers Network, which represent private healthcare providers in the UK. David will be sharing the changes that private hospitals have seen and an insight into what these might be driving these changes. There will be time for questions at the end, and you could submit them via the questions tab in this window. If the window is not there, click on the white arrow on a red background and it should appear. When you've written your question, please do remember to send it. So without further delay, over to you, Peter.
Thank you, Brian, and good morning, everybody. Thank you again to Brian for giving us this opportunity to present to you. And today, what I'd like to do is give you some insight as to what is occurring right now in private healthcare, and in particular on the insured side of private healthcare. I expect a lot of you today don't really know a lot about health code. So just to give a little bit of context and really insight into how we're able to present these figures to you. As Brian mentioned, we are the clearinghouse for the private healthcare sector. And what that means is effectively the healthcare providers for insured transactions, insured invoices, they send the invoices to us rather than direct to the insurer. And health code performs a variety of processes on those invoices, in particular to make various checks for standardization. We check things like membership numbers, policies, prices, make sure that they are valid, and then we pass them on to the insurers for subsequent adjudication and payment. So effectively all this traffic comes through us, and it's quite a lot of traffic. It was, well, I'm about to tell you what the actual volumes are, so I won't steal that thunder, but we cover throughput for pretty much all the private hospitals, all the insurers, and the overwhelming majority of practitioners. So it's a pretty good barometer. It's, forgive me for sounding a little arrogant, it's as good a barometer as you're going to get for activity in private healthcare. Now, just one last thing on those invoices. You'll probably be aware that private healthcare is dealt with on a fee-for-service model. So effectively what that means is all the billable services that insurers pay for are defined and detailed on those invoices, and therefore that gives us really significant insight, powerful insight into what actually services are going through the healthcare market. So I'll start on the first of many graphs, but this first one will just give an overall activity level for private healthcare in the last decade. And I've drawn a line, a flat line over 2019, just to effectively set that as our pre-pandemic barometer. Now, the first sort of 4 or 5 years on this graph are potentially a little bit misleading, because health code, although we've been established for over 20 years now, we are still acquiring customers, particularly on the practitioner side of the market at this period. So I'd treat that with a little bit of pinch of salt in terms of market growth, but certainly for the last 5 or 6 years, you can sort of see what happened in that period. Now, There is obviously a dip in 2020, no prizes for guessing what that is. And if I just look in a little bit more seasonality on that perspective, you can see a month by month view for the last 5 years. And what that shows us, three things I think are pretty apparent on this. The first one that stands out most is that pink line, which is 2020, where obviously volumes dipped during the pandemic. The low point was May. Contrary to potential popular belief, it didn't go to zero. There was still activity in the private sector during this period, but it was less than a third probably of what we would have normally expected. The other thing this graph shows naturally is the seasonality of private healthcare. So in a largely elective model, you will see obviously the low months towards December, January, around Easter and the summer holidays, and then the higher months the rest of the period. So you'll see those seasonality trends, and we see that regularly in every year, which is what you'd expect in an elective model. And then I think good news for health code, possibly less good news for Brian, is that light blue line, which is 2023, which is the top line, and we are definitely seeing quite significant market growth, which is what I'm going to come on to in a few minutes. So yeah, I think those three things are key here: is pandemic, seasonality, and then 2023 is significantly higher than previous years. Just one last context slide, which is very much just looking at the hospital and non-hospital split. And again, this is looking over pretty much a 10-year period from 2013 to 2022. 10 years ago, the overwhelming majority of claims and activity that we processed was in hospitals, and now it isn't. Now, going back to my first point, there's a bit of health code in that in terms of us acquiring customers, but it's not just that. We are seeing more and more activity in a non-hospital setting. Now, this isn't value-based, this is volume-based activity, but we are definitely seeing more and more, the vast majority now of private healthcare activity in a non-hospital setting. Again, probably not a surprise, but there's a clear trend over the years in that way. Okay, I'm going to move on now to a series of breakdowns and comparisons, and I'm going to try and talk through these because I hope you can see the numbers, but they might be difficult to see. So this is just comparing 2023 with last year, 2022. The right-hand side of that screen is overall activity volumes, and the left-hand screen is the same thing, but it's splitting out hospitals and non-hospitals. And you can see pretty much consistently that activity on the right-hand side, so overall aggregate activity is 20% up on last year. It's a real significant growth. It is consistently 20% month by month. And how that translates into hospital, non-hospital, the dark blue rather than the black is the non-hospital. And again, that's really between 25 and 30% up, whereas the hospital activity is still up, but around about the 11 to 12% on average. But you can see very clearly those activity levels for this year are much higher than before. So I think that's number one breakdown. Number two is if we look very much at the hospitals now and just determine or investigate how the admitted and non-admitted care is split. Again, probably not a surprise, but the admitted care is about 15% up. In 2023, we have exceeded 2019 levels, but only just. So definitely from the pandemic onward, admitted care did take a bit of a dip, but it's back up now, whereas the outpatient activity is around 20% up, so more activity is happening in the outpatient setting. Probably not a surprise, but you can see that. And just for the avoidance of doubt, sorry, I should have mentioned these figures are up to date as of the end of July. Didn't quite have time to get August figures into this presentation, but these are up to date as the end of July this year. If we look at a regional breakdown, so on the left-hand side, you've got the 4 devolved nations, and the right-hand side, you've got a breakdown between London and England. The biggest area of growth, and don't ask me to explain, but the biggest area of growth that we've seen in this year is Wales. And definitely those volumes have been highest there relative to last year, followed by England, and then the Northern Ireland big figure in May, I think, is more to do with operational activity in 2022 for one hospital rather than actually a trend. But Northern Ireland and Scotland are just about slightly higher than 2022. Wales significantly higher. London and the rest of England are very similar. So again, reflecting the aggregate figures as well. I mean, obviously, I think you'd expect that the vast majority of our volume would be dominated by activities in England. So that reflects the market as a whole, as you'd expect. Looking now at the next breakdown, which is the specialty-based one. Probably no surprise, but just confirmation is by far the biggest specialty that we see. It says orthopedics and trauma. That's the name of the specialty. Officially, effectively, it is orthopedics, and orthopedic surgery is by far the most common hospital activity. The next sort of surgical activity you'd see is general surgery. Again, probably not a surprise, which is number 4 on the list. And then you see things like radiology, physiotherapy, pathology, etc. coming next. And those are really reflecting the diagnostic services that happen in the hospitals as well as the surgical. So probably no surprise, but orthopedics still dominates the activity for the private sector. Then it's general surgery, and then you see all the diagnostic-based activities. Getting on to more of a price-based view. Now, this is quite interesting, actually. So what we've taken here is a view of the average hospital invoice value over since 2021. So we've taken quarterly steps here. So obviously on the right-hand side, we've got the second quarter of 23 going back to the final quarter of 21. So just looking at what the average hospital value of invoices, so the average hospital prices, and they have stayed fairly flat. To be honest, so for an admitted episode, the typical cost for an insurer is about £3,000 per episode. This is on average, of course, and then for an outpatient, it's about 460, and that hasn't really changed that much since 2022. So there are a lot more of those activities, no doubt, but the actual average price of them has not changed that much over that period. So I do appreciate I've bombarded you with statistics. So just to sort of summarize, I think what's happened, the insured claims volumes, they're up 20% this year. And that's 20% over 22, and 22 was about 13% over 21. And 21 was still back ahead of pre-pandemic levels and the highest we've ever seen. So there is no doubt that those activity levels are significantly higher than they've ever been. The most activity that we see in health code is diagnostic activity. Probably no surprise there, but that dominates those activity levels. And when we think about hospital care, I think the reason I made this point is a lot of our thinking is sort of dominated by its hospital-based activity. Only 16% of the actual hospital activity is actually admitted care. So the vast majority, over 80%, is outpatient care in those hospitals. However, in terms of the prices, in terms of where the money goes, over 50%, so 56% of that hospital value is in the admitted care. So hospital admissions are by far, probably not surprisingly, but by far the most expensive aspects of care in private healthcare. So I think I've rattled through that, hopefully on time. So I think I'll hand back to you. If that's okay now, Brian.
Thank you, Peter. Really insightful and some pretty scary numbers showing the real step change in treatment frequency over the last 12 months or so. One question that I would like just to ask, you had your the slide up there with the bar chart showing the volume breakdowns by speciality. Which of the individual conditions might have seen the biggest increase in activity over the last year or so?
Yeah, that's quite interesting. We have looked at that. We looked at it actually in the benchmark of 2019, and what was quite interesting, or maybe it did surprise me, is that very little change. So the patterns are very, very similar. It's always been dominated by orthopedics. In fact, in our top 10 list, there was only one change. Our top 10 list in 23 includes cardiology. It didn't in 2019, and the one that it's replaced was ENT. So ear, nose and throat, obviously. So other than that, though, the spread by specialty was very, very similar. I think that was looking in the hospital side. I think if you look beyond the hospitals, then there's no doubt that mental health claims have increased very significantly, and we're certainly seeing on the provider registration side, mental health is one of the fastest growing specialties and professions.
Thank you, Peter. And that takes us to our second speaker to bring those figures to life and perhaps understand why consumers are using private healthcare more and what the prognosis for the future might look like. David, over to you.
Thank you, Brian, and many thanks for the invitation, and great to see so many people on the call. Brian says, my name is David Hare. I'm the Chief Executive of the Independent Healthcare Providers Network. We're the trade association for the UK private healthcare industry. It's my intention today to talk through a little bit around what's going on in the NHS, because it's impossible to disconnect, frankly, what we're seeing in private healthcare at the moment and what the challenges are, particularly post-pandemic facing the National Health Service. Some of the trends in privately funded healthcare, I won't repeat what Peter has expertly talked through in terms of the insured data, but have a look perhaps at what's driving it from a consumer sentiment perspective. We've done a lot of work looking at this over the last year, 18 months, and perhaps a little bit of a forward look as well. Where are we all going with this? To say who we are, a trade body for the UK independent healthcare sector, trying to ensure that supporting our members deliver great care to NHS and private patients across all 4 nations of the UK. Got just over 100 members, subdivided as this pie chart demonstrates. Around half our members are hospitals, so brands many of you will be familiar with: Spire, Circle, HCA, Nuffield, etc., but also a very healthy mix of organisations in other parts of the healthcare market as well. And of course, private healthcare is a huge industry in this country. Employs or contracts with well over 150,000 staff. Our members alone deliver service from over 1,800 sites, and this just gives you a bit of an idea around the volume. As an industry comparable to many other large industries in the UK, it's only really when you compare us to the NHS that we're perhaps relatively small. In terms of quality of care delivered by the sector, 94% of our members are rated good or outstanding by the care regulator, the Care Quality Commission, and for hospital care, acute care, nearly 100% of NHS inpatients treat the care they've received is good or very good, and over 9 in 10 of acute independent hospitals are now rated either good or outstanding by the Care Quality Commission, which compares very favourably to the wider healthcare system. So both significant volumes, but also by and large high quality services as well. So in terms of NHS performance and what's going on, and barely a day goes by where you don't read some headline about challenges facing the NHS. There's a number of indicators here that I've drawn out. Now, the overall NHS waiting list, as that chart demonstrates, has grown materially since the onset of the pandemic. It was around 4.4 million when the pandemic hit in early 2020. The most recent data is 7.6 million, and that's going up pretty much by 100,000 every month. You'll see that actually performance was declining somewhat really in the years preceding that, but really that decline has been turbocharged significantly by what we've seen in the pandemic. I've also drawn out there some of the pressures in A&E. I could have presented information around ambulance response times, the number of people waiting over 12 hours in A&E now, the challenges to get into general practice. All of that has a material impact, I think, particularly on the kind of planned care that the independent sector delivers, because where you've got pressures in the emergency pathway, that will often squeeze out so-called elective or planned care, maybe cancelling lists, and we know that happened fairly regularly over the winter, but it's pretty much a perennial winter now in the health service. So pretty much on every metric you can see it is flashing red with what's going on in the NHS. In terms of the sort of planned care position, which is often what a lot of private healthcare is focused on, as I say, a new record high waiting list for the date for the month of June, which is the most recently available data, of over 7.6 million people. I think we can expect that to continue to rise, not least given there doesn't appear to be an end in sight for industrial action. When you then break that down, 41% of the total list, that's over 3 million people, are waiting longer than 18 weeks. You should have 92% of, this is the legal commitment, 92% of patients seen within 18 weeks, but you've actually still got nearly 400,000 people waiting longer than a year. Now, to put that into context, in 2019, you would have had a few hundred. So you can see the extent to which people are waiting materially longer for treatment. What's going on in terms of activity levels? Well, it struggled to recover across the NHS. Admitted activity is up compared to 2022 so far this year, but only 2% above activity levels from 2019. So if the NHS is going to play a major catch-up, it will need to drastically increase productivity, and that is going to be a real challenge. Of course, private providers do also deliver NHS funded care as well as private care, and actually are doing more as an overall share of activity within the NHS than both in 2022 and, I guess, more pertinently in 2019 as well. So what are we seeing in terms of private pay? We do a lot of work with focus groups, with kind of insight polls, etc., to understand what's going on, and we'll shortly be launching a major report looking at the attitudes of consumers to private healthcare, both self-pay and private medical insurance. I'll come on to some of that in a minute. Before I do, just a bit of a global perspective. Now, this chart is somewhat old, but it hasn't changed dramatically. And what it tells us is just how much of an outlier we are within the G7 about how much healthcare is bought for us by the state. Now, every system will be somewhat different, and we'll have social insurance systems, etc. But the state, through general taxation, does a considerable heavy lifting for the amount of healthcare that we consume in this country. And I think it's worth bearing that in mind when we think about long-term trends, particularly as the NHS is on course to be 50% of public sector employment. It's taking an ever greater share of the overall slice, and we know the economic challenges and therefore tax receipts are challenged. And I think it's an interesting question to ask ourselves as to whether or not that can be sustained whilst delivering a healthcare system that works for the people of this country. Peter touched on some data. There's an organisation called the Private Healthcare Information Network, which is mandated to collect a lot of data, including on quality within the sector. That also does volume activity. This doesn't in any way contradict what Peter's done, and Peter's much more up to date than this, but it demonstrates again that trend. The reason I've added this is it also includes self-pay, or the number of people funding their own treatment, and as can be seen, that's significantly increased on pre-pandemic levels, although has plateaued. But I think the story of 2023 is the sheer number of individuals who are insured either through their employer or directly themselves, and I think that is likely to continue. Why is it that people access private healthcare? You'll see from this, again, this is sort of an early sight of our consumer insights report. I couldn't get NHS appointments quickly enough. You know, over 45% of people saying that it's the inability to be able to access the NHS that's causing them challenges. When you add towards the bottom there, my NHS appointments were cancelled or postponed, what you really see there very much is either I can't get in, or when I get in, I'm cancelled. That's what's driving me to private healthcare. It's very much that driver. There are other factors in that as well, largely about the quality and accessibility of private healthcare, but it's undoubtedly the case that what I've just described in terms of NHS pressures is driving a lot of what we're seeing at the moment within within the market. I think what's really pleasing is that within that growing number of individuals, those who have used private healthcare really value it. They see it either very positively or quite positively, which is distinct from how people see it amongst those who have not used private healthcare. So that experiential sort of moment that people have tends to mean that they reflect very positively on that healthcare, which I think is very positive, certainly for those looking to put services in place. And of course, the environment that we're in at the moment, again, particularly post-pandemic, huge numbers of working days lost to sickness, a record in 2022. Polling we've done shows that well over half of businesses are really concerned now that current NHS waiting times will increase their sickness absence rates at work. Certainly talking to employers through focus groups we've done, people really nervous that will have a negative impact on their productivity as an organisation. Interestingly, and I don't think this is the right figure in terms of actual number of insured lives, but the public sort of report broadly that 1 in 5 of them say they have some sort of private health insurance plan. And pleasingly, very positive views of private medical insurance. 87% of those that have used it feel like it offered good value for money. And clearly now a growing number of people who say, particularly in a tight labour market, do you know what, in a world of very pressured NHS performance, I want to ensure that an employer I go to offers me some sort of private medical insurance or certainly health support. 50% saying they're more likely to apply for a job with an employer that offers PMI, and that grows particularly with younger generations. And then finally, very interestingly, 1 in 4 of those who have used private healthcare say they would not go back to the NHS if they needed further diagnostic or surgical treatment in the future. Government is looking at this. It's currently consulting extensively on further support for occupational health, principally through tax incentives for occupational health. They're actually asking the question whether or not tax incentives for private medical insurance would be an appropriate thing to do. I think in the run-up to a general election, I feel that's probably unlikely, but they are looking at how can they support employers to do more across the full range of occupational health. And I think what we're beginning to see there perhaps is a bit of a shift away from looking to the NHS and the state to support health and well-being, and looking now increasingly at employers. So you've got both government looking at employers, and you've also got employees and potential employees asking the question, what is my employer or potential employer going to do to help me keep healthy and well? Some interesting challenges for private healthcare, which we kind of live and breathe working on. I think it's still the case that some customers find navigating private healthcare to be a challenge. I think there's more that can be done to simplify that. Often costs can be unknown. Perhaps a bit more transparency we could introduce. And I think you do sometimes have a sense that the private market is not as integrated as it could be with the NHS. I think the future is very much people will still use the NHS. We're all NHS patients, but will also use private healthcare. And I think there will be, in time, a debate to be had about how those two systems fuse together. At the moment, they don't always speak as well to one another as they could. But fundamentally, I think the macro position in terms of growth, for all the reasons Peter described, we're likely to see sustained growth across private healthcare. Looking ahead, this isn't a prediction, by the way, I should add, but they are 20 points ahead in the polls. A general election set for likely next autumn, but could be as late as January 2025. I think what we've seen in terms of where this is all going is both of the main political parties talking actually quite positively about private healthcare, particularly the role of private healthcare within the NHS. But in terms of that forward look political impact, we would expect either political party to want to focus on supporting employers with keeping people healthy and well, and I suspect, even if it's relatively discreet, a positive view of supporting the private market, as well as trying to do what they can to improve overall NHS performance. So I'll pause there and hand back, Brian.
Thanks, David. The survey results of consumers, I think, really tells the story behind Peter's data. So 2 great presentations. Thank you both very much. Now, there have been a few questions coming through, which I'll try and pick out. first one, yeah. Is what we're seeing in the UK healthcare at the moment a reflection of the NHS just needing time to recover from the pandemic, or is there something a bit more fundamental going on? David, perhaps you could have a go at that one first.
Yeah, happy to, Brian. I think so. I think there is something more fundamental going on. I mean, you saw in some of those charts that even though I think people sometimes think the pandemic was year zero of the NHS's current travails, actually there had been deteriorating performance on a number of metrics for quite a long period of time, really throughout the decade of 2010. You juxtapose that up against then some of the economic constraints that we're facing as a country, the fact that the NHS is already taking an ever greater share of the public sector spend. I think governments around the world are going to be looking at needing to spend more money on net zero, on defence in response to what we saw in Russia, Ukraine last year. It seems, I think, inconceivable to me that through the taxpayer, through general taxation, that we can get the NHS performance will be back to levels that it was maybe sort of 15 years ago or so ago for quite a long time. And therefore, what we're beginning to see is a bit of a Rubicon crossed, which is people will mix and match, and that will mean more private healthcare consumed in varying different ways, some through insurance, some through occupational health, some through self-pay. But I think we are in a different dynamic than maybe we were a number of years ago.
Okay. Second question, do you see the current growth in insurance claims continuing to rise at the same level, or do you expect it to sort of plateau out and become the new norm? Peter, perhaps you could answer that one first. I think you're muted, Peter.
Sorry, thank you. Wasn't me. I do think it's probably a new norm. Whether we'll see the level of growth sustaining, I don't know, but I don't see the level of growth achieved declining in any way. And I think David, obviously far more knowledgeable than me in this area, but has articulated a lot of the reasons. I mean, I think the increasingly competitive employment market means more and more employers are offering private healthcare. We, as part of our processing activities, we host databases of insured patients, or insured members, I should say, to facilitate the processing, and those databases have got a lot bigger, and they're not getting any smaller. So I think we're seeing that volume through. I think the point that David's made so eloquently about the NHS waiting times isn't going to go away and going to change anymore. And I think there's another point as well, perversely, that I think a lot of PMIs have actually made it easier to claim as well. There are more and more online accessibility options now. There's a lot of the online GP services that a lot of insurers are offering as well. And I think those different changes in the proposition and the product have made it easier to claim. So I can't see those volumes declining in any way.
Okay, David, perhaps you could add your pennyworth.
I totally agree with what Peter said there. I think it is inconceivable, frankly, that the growth we've seen won't continue. I think there will have been a bit of a post-pandemic effect, I suspect, coming out, and those that struggle to accessing. But as Peter's data points out, actually private care did continue during the pandemic, just at a lower level. So I think that's probably largely fallen out of the numbers now. I think what the data is telling us is that employers are concerned, and therefore many more of them are looking at, okay, what are my options to support both the well-being of our existing staff and as a clear statement of intent for incoming staff, and individuals in varying ways, including direct out-of-pocket payments, are also saying, I'm going to have to take responsibility here as well. So I think that overall growth in the industry is set to continue for some extensive period to come.
Just to follow up on that then, so I think we've seen some reports of some increased waiting times privately to see a consultant, or indeed then going on for surgery in the private sector. What have private hospitals been doing to increase capacity, and is there room for further growth?
So yes, there is. I think there is room for further growth. I think private hospitals around the country have been pretty relentlessly focused on productivity and throughput. They're already pretty productive entities, but how you can kind of squeeze more juice out, as it were. Extended hours, evening, weekends, we tend to find that patients are pretty comfortable actually if offered a scan at 8 o'clock in the evening, as long as it's pretty quick. Actually that often works. People are content to do that, including on weekends. Workforce wise, we're seeing people want to work in the sector, both internationally and from other parts of the healthcare system as well. Clearly, capacity will vary by geography. The central London market will be different to other markets outside, but fundamentally, I think there is capacity there, and I think people are looking at the market and saying, well, can we come into that? Can we compete? Can we add capacity as well? It's quite a lively, dynamic industry at the moment because of that growth.
Okay. Now, as we only got sort of 4 or 5 minutes left, slightly more complicated one here. We've heard a lot recently about the growing link between health and wealth and the extent to which sort of post-pandemic ill health is having an effect on the economy. What are your reflections on that, and what do you think needs to be done by way of a response?
Yeah, I think there's happy to pick up first. I think there's definitely some of the data coming out at the moment around what's happened post pandemic with the number of people that are off work now, long term sick. You're massively up on where we were on 2019 and well below competitor nations. And I think what we're seeing, again, in a tight labour market, but with a focus from politics of all stripes on how do you grow the economy, is a big component of that is keeping people healthy, making them healthy when they fall ill, getting them back into the workplace, keeping them in the workplace for as long as possible. And I think it's going to be impossible for any government for the next few years to develop a plan for the UK economy that doesn't put the health of the nation at the heart of it. And that cannot be done by the NHS alone. That is going to require a number of other products and services that individuals and employers will have to consider to help to grow the economy. So I think this is an issue that isn't going away.
Okay, I was going to say, perhaps you missed your calling from Ricky last week in the cabinet reshuffle. Perhaps should have had a go for that one. Now, time is very tight. One last thing, David, in your presentation, you talked about the government consultation into occupational health. Is there anything that employers should be doing? People who are attending the webinar.
Yeah, I certainly think look at that consultation. It's live and open until the end of October. It's on the Treasury website, and I think it is one of those ones where the business voice is going to be critical here, because it's very much aimed at businesses. What will help businesses to support their staff to stay healthy? That's fundamentally the statements being made by government. People will have views on the tax treatment of private medical insurance. Our own view is that should be better incentivised than it is now. But clearly there are other ways around the golf course as well for other types of products and services, and I would encourage anyone to have a look at it. That will help people understand the direction of travel, but also to engage in it and put their organisation's view.
Perfect. I know we've got some links, so perhaps when we send the write-up out to people in a few days' time, we'll include those links. I am mindful of time, and I think what we've seen has been two very helpful presentations, and I hope have provided some answers as to why many company schemes have seen some fairly significant shifts in claims behaviours and costs. And whether you are an employer or a broker, it will have provided some context and perhaps assist you in the sort of financial planning and funding of healthcare schemes moving forward. I'm particularly grateful to Peter and David for their time, thoughts and insight into a world which we don't often see. And I do feel that there could be some real value in revisiting some of these numbers in a year's time. So a big thank you also to all of you for attending, and I hope you found it as interesting and useful as I did. As I said, we will be circulating the recording and webinar write-up in the next few days, so please look out for it and feel free to share it with any colleagues who might be able to make it.